Dr. Ryan Westergaard, the Chief Medical Officer of the Department of Health Services, joins us now. And Dr. Westergaard, we appreciate you being with us this afternoon. This is great news. Now, in relation to the vaccine and the Pfizer vaccine, how are things going so far?
What we hear is things are going relatively smoothly. We received about 10,000 doses in our initial shipment yesterday. DHS, the State Health Department, facilitates getting those out to 8 regional hubs, and then we're collaborating to get those out to the clinics and the hospitals where they can be administered. So we haven't heard about any problems so far, so we're encouraged that it's going smoothly.
That's excellent. Now, do you have any idea, Dr. Westergaard, how many people have actually received the vaccine so far? I know it's very early on.
Right. We heard of a few yesterday already, which was exciting. We don't know precisely how many so far yesterday and today, but we will be able to know those numbers relatively soon. Every dose gets logged in our Wisconsin immunization registry, so we'll be able to see on a daily basis how many vaccines are administered. And then we are working on some visualization on our website so that the public can track how much vaccine has been given, but we're not. That's going to be a few days away yet.
Oh, well, that would be interesting to see. Now, Dr. Westergaard, as far as the next step go, a lot of people asking, what is the timeline for healthcare workers in Wisconsin to be fully vaccinated? Do you have any idea what that might be?
Yeah, we can't speak to that precisely. You know,
Right.
our estimates of how much vaccine we're going to be getting are in the tens of thousands per week. So we're hoping in the next month or two we'll get the majority. But it's a big logistical challenge, and a lot of work needs to be done yet.
Yeah, this is not easy. And now, what about other groups, Dr. Westergaard, for people like nursing home residents and essential workers? We know they really need to be vaccinated. And of course, then it's the general public. But what about these essential workers and healthcare workers? What do you think that timeline is looking like right now?
Yes, well, this very first phase that we're in focused on healthcare workers, and then importantly, the other very high-risk groups are people that live in long-term care facilities. And Wisconsin is participating in a federal program with some large pharmacy corporations to get the vaccine to those people at the same time. So that procedure is going to launch later this month, and we're going to try to get, with federal assistance, as many of the long-term care facility residents and the staff in those facilities immunized as quickly as we can in the next month or two. A month or so after that, we're going to work on other high-risk individuals in the general population. And I think this is going to be a project that unfolds throughout 2021. And it's not going to be quick. We need people to be patient, but we do want everybody to participate and everyone who's eligible to get a vaccine, because it's really going to be a very useful tool to stop transmission of the virus and hopefully get us out of this pandemic.
Yeah, going to be very important. And the Moderna vaccine, and we know, seeking approval, and it could be coming in a few days. Now, how is the state of Wisconsin preparing for that arrival as well, Dr. Westergaard?
Yeah, that's also exciting. So the vaccines from the Pfizer and the Moderna vaccine are very similar. They use the same type of technology, the messenger RNA. The data suggests that they're both highly effective. There's some advantages to the second one, the Moderna. It doesn't require the very, very cold storage at the ultra low temperature freezers. So it'll actually be somewhat easier for us to get the shipment of the Moderna vaccine out to the clinics and hospitals where they need. But because of the timing and the regulation and the approval, it's about a week or two behind, but it'll be here soon enough.
Well, Dr. Westergaard, you have to be encouraged by news that shows that the polls are showing that people are more likely to get the vaccine. They're becoming more interested in getting it. And that's been an increase over the past few days. That has to make you feel good.
I'm encouraged. I share with everyone who will listen that vaccines are some of the most effective and the most cost-effective public health intervention that we've ever had. And this vaccine in particular has a potential to do enormous good for our society and for our world. And the procedures that we've developed to show that it's safe and effective have been as reliable as any other vaccine. So I have a lot of confidence in the system, and I encourage people to look at the data and what we're learning together, and we can all feel confident that this is a process, and I hope it's something that everyone wants to participate in.
And have you gotten the vaccine, or are you getting it soon?
I'm on the list. So I'm
Okay.
an infectious disease doctor. I work in the outpatient setting, so I'm happy to let people who are like my wife, who's an emergency room physician, line up first, because they're really at risk. The people that are on the front lines in our ICUs and emergency departments need to be first in line, but I'll be ready when my name is called.
Well, I think you're among millions. Dr. Ryan Westergaard, we appreciate you being with us this afternoon on TMJ4. Thank you very much, sir.
Thanks for having me.
Mhm. And here's where the numbers stand today: 3,500 new cases in our state since the pandemic began. Wisconsin has had more than 442,000 positive cases of COVID-19. 54 more people have died from COVID-19, and that brings our total to past 4,100. And we are always tracking vaccine news, including the pending approval of the Moderna vaccine. All you have to do is go to tmj4.com/coronavirus to see the very latest.